Hello everyone, good evening. I am Dr. Dhiraj Agarwal, consultant gastroenterologist and liver specialist working at Continental Hospitals, Gachibowli, Hyderabad. Today I am going to speak about an issue which affects millions of people, however is being ignored often, assuming it's a very trivial issue. So today let's understand what are the digestive red flag signs and their link to liver diseases and GI problems. You may think that little bit of stomach pain, bloating, acidity or burning isn't a big thing. There are minor things and they have no deep connections with our gastro problems. However, this may not be true. And let's explore why paying attention to these little issues can take our digestive health long. So, digestive red flag signs are the symptoms that may seem minor but could indicate underlying problems in your gastro system or liver system. For example, bloating, persistent bloating. This could be a sign of liver disease. It could be a sign of irritable bowel syndrome, or this could indicate even a food intolerances or indigestion. Now take example of frequent heartburn or acid reflux. This could be a sign of hiatus hernia or gastroesophageal reflux disease. And having this disease for a long time can lead to inflammation in the liver, that is Barrett's esophagus and liver and esophageal cancers. Now take example of unexplained weight loss. Unexplained weight loss can be because of inflammatory bowel disease or having some chronic infections in the gastro system, or it can indicate some kind of cancers inside the stomach. Or if you take example of abdominal pain or discomfort, this can indicate having an ulcer in the stomach, or it can indicate some kind of liver inflammation. So it's crucial to identify these symptoms early and to seek medical advice. So now let's discuss what are the common GI problems and what are the solutions for them. Now let's take one of the first problem, that is a fatty liver disease. How many of you are having fatty liver disease? Can you raise the hand? I think many, almost half of you. I can see at least few hands. Yeah. So what is fatty liver disease? As the name suggests, there is accumulation of fat in the liver, and this is called as fatty liver disease. So is it harmful thing? Yes. So after alcohol, fatty liver disease is the second most common reason in India for liver to get damaged. So fatty liver in the long term can lead to liver inflammation, liver fibrosis, liver scarring, liver damage and liver cancer. So what should you do to take care of your fatty liver? You must stop alcohol, you must reduce your excessive weight, follow a healthy liver safe diet, avoid over-the-counter medicines, don't take unprescribed medicines, get vaccinated against hepatitis B and A, and follow a good healthy lifestyle. These are all the things that you can do to achieve a good liver health. Now let's take a second example of GERD. GERD means gastroesophageal reflux disease. Let me take an audience poll. How many of you have acid reflux problem? Like you feel some kind of burning sensation in the stomach or in the chest? Yeah? You can raise your hands by waving the hand or something. Yeah, many of you? Yeah. So it's quite a common problem, and there are various reasons that one should be having this acid reflux problem. The number one reason is the irregular lifestyle, excessive tea, coffee, alcohol, smoking, irregular meal timings, late night sleeps, inadequate sleep, stress, and eating outside food, spices, oily foods. All these things are the reason that one can get acid reflux problem. There are other reasons also for acid reflux, like taking a lot of medicines, painkillers, some Ayurvedic medications. All these things also can lead to acid reflux problem. Some people, they do get stomach infection, and that might be the reason for you to get acid reflux problem. So what should you do if you get acid reflux problem? If it's a chronic recurrent problem, please seek expert help, meet a gastroenterologist and get the endoscopy done. And from there we can come to know whether you're having any infection in the stomach like H. pylori something. So to tell you, H. pylori is a bacterial infection which is a food or waterborne, and it leads to chronic gastritis, and it leads to chronic hyperacidity, and it can lead to GERD, that is acid reflux problem. Alright, so next let's take some example of hepatitis infection like hepatitis B or C. These are the chronic infection which can affect your liver. On the other hand, infections like hepatitis A and E are the food and waterborne infection which are the acute infection and can lead to jaundice in the liver. In Asia, particularly in the Eastern Asia, hepatitis B is the most common reason for one to develop liver cirrhosis and liver cancer. And how does it spread? It spreads through the parenteral contact, that means through the IV drug abuse, then blood transfusion, unsafe surgery, unsafe close contacts. These are all reasons for one to acquire hepatitis B. And what does the hepatitis B do? Over many decades, it leads to liver infection, liver damage, liver scarring, and liver failure. So what should you do if you are hepatitis B positive? Again, seek a liver specialist nearby you and get the battery of tests like liver function test, ultrasound, and check the hepatitis B DNA levels. And from there, the doctor can take it forward by treating you with some kind of antivirals, medicines. So, if you are experiencing any of the symptoms, here are some actionable steps. Don't ignore the symptoms. Take a balanced diet, stay hydrated, exercise regularly, maintain a healthy weight, limit alcohol intake, avoid the over-the-counter medications, get the regular health checkups done, and stay vaccinated. These are the few things you must do. So if you're experiencing any kind of digestive issues, remember, you are not alone. And solutions are available, whether it is identifying red flags or managing chronic condition. The first step is to seek professional advice. Are you all there? I'm audible, right? Yes. So, at Continental Hospitals, we are dedicated to helping you take charge of your health with advanced diagnostic tools, personalized treatment plans, and a team of experts. We ensure you get the care you deserve. If you are having any concerns or questions about your digestive health, don't hesitate to reach out, because together we can work towards a healthy future. Thank you. So I think I can see almost many people over there, and there are a few questions in the chat box. And we can take the questions if you have any questions. Okay, let's take the first question from the chat box. And the first question is, what does frequent heartburn or acid reflux indicate about your digestive health? So we just discussed this thing. A persistent heartburn or acid reflux indicates that either you are having more acid in your stomach, or that acid is coming up inside your food pipe for some reason. So it indicates there is a chronic gastritis, or you are having gastroesophageal reflux disease. Yeah. So let's take the next question. When should unexplained weight loss become a concern for liver or GI health? So, very good question. Unexplained weight loss is a weight loss of more than 10% over a 6 months time, and that is unintentional. So suppose you are 60 kgs in a weight and you experience a weight loss of 6 kgs over a 6 months period, it means that it is significant weight loss, and there has to be a reason for you developing this weight loss. So yes, it's a very concerning symptom. So whenever you are having this unintentional weight loss, it's definitely a matter of concern, and you must seek a doctor to rule out if you are having chronic infections like tuberculosis or any kind of food intolerances, or in a worse scenario, situations like cancers or malignancies. Hello, I'm audible now? Yes. Yes, somebody please raise your hand or give me a thumbs up so I know that I'm audible. Alright, so the other most common reason for being bloated or gassy is the food indigestion. So a lot of people have this milk intolerance or a gas intolerance or a lactose intolerance, and that is one of the most common reason for one to feel bloated after taking milk or milk products. The second intolerance that is commonly seen is the gluten intolerance. So the gluten is a chemical which is found in the wheat, and some people who are intolerant to gluten can develop bloating or they can feel gassy. And otherwise, there is a category of food which is called as a high FODMAP diet. So people eating high FODMAP things can feel bloated or gassy. All right. So let's take another question from Mr. Bang Ajju. Sir, my uncle is suffering from cancer and he's using Osimod 80 milligrams. Treatment is going good, but if he is avoid gas tablet, then he unable to eat food because of stomach full. Can you please suggest? Mr. Ajju, I read your question and I will really like to know more about this cancer thing, because there are various kind of cancers in the body. I don't know what kind of cancer your uncle is suffering from, but if he's feeling gassy and bloated, we need to check whether it's really the gas or some kind of water in the stomach, or it is something, a cancer growth which is making him feel bloated. So can you please get back with these answers, and I will take it further then afterwards. Okay. So Mr. Rampalli Ravichandra says outside food is not healthy. Yeah, that is right in a way, because given the hygiene situations in India, when we eat this roadside or bandi side food, definitely if the hygiene is not good, from the outside food we can get various infections like hepatitis A or E, which can lead to liver infection or jaundice. And certainly that's the reason, or we can get diarrhea, we can get loose motions, we can get stomach pain, we can get vomiting. So because of all these reasons, I can say the outside food may not be good, and we should eat healthy, homemade, fresh food. So One of the next question is how often, it's from the Nagur Sheikh 09, and he asked me how often should someone undergo liver function test or endoscopy. Very good question. So one may not need to keep doing this test regularly, but if you have any symptoms, any gastro-related symptoms, or if you have any risk factors like taking alcohol, or if you're obese, or if you're having fatty liver, or if you have any unsafe sex, if all these things are there, then I would really recommend you to getting the liver function test done. As for the endoscopy is concerned, if you're having any gastro symptoms like acidity, gas, bloating, constipation, flatulence, if any of these things are there, or if you're having bleeding in the stool, if all these things are there, you must undergo endoscopy. So there is a question from Mr. Okay, so let's take the next question. The next question is from okay. Yeah, this question is from Pooja, and Pooja is asking, hi doc, what common conditions are linked to liver and gastrointestinal problems? So basically, Pooja, in my practice, I come across every single type of gastro and liver problems. But if you ask me what are the most common problems that I encounter, 70% of my practice, patients complains either of acidity, they are having either gastric reflux disease, or if they are having chronic gastritis, or they have constipation. The next most common set of problems that I encounter are the fatty liver disease and the alcohol related liver damage. And the other set of problems that I encounter is the IBS. IBS means irritable bowel syndrome. Okay, so another question is from Mr. Satish Kumar 2345, and he's asking how much time will it take to cure H. pylori infection? So H. pylori, as I said you, is a chronic infection in the stomach, and it generally takes around 2 months time to get cured, out of which 2 weeks is the time for antibiotics. We need to give you some strong heavy antibiotics for 2 weeks time, and followed which we need to give you some medicines to suppress your acids for another 45 days. So after you are diagnosed with H. pylori, this treatment lasts for 2 months time, and after which we recheck whether this H. pylori has gone or not gone. So there is another question from Mr. Pillai, and he's asking, sir, what are the causes of IBS? What are the precautions to avoid? Regards. So IBS is a very challenging situation and a disease. The name, to spell out this acronym, IBS means irritable bowel syndrome. So in this thing, there is some problem in your bowel, and it irritates you every single day. It affects your quality of life, it disturbs your routine, it disturbs your productivity. And however, there is nothing major concerning because all the reports will come correct. So there are various causes for IBS, like namely, if you are having food intolerances, you must check if you are allergic or intolerant to some kind of food. You must check if you are having infection in the stomach that is leading to this IBS. Some people, they have gut dysbiosis. It means that there are various bacteria in our stomach, and if there is any imbalance of these bacteria, then it can lead to IBS. It means that if the good bacteria decreases and the bad bacteria in our stomach increases, this situation is called as gut dysbiosis, and this can lead to symptoms mimicking IBS. And another most common reason for IBS is the stress. So those who are having very stress, or they are having any stressful condition in their life, these all people experience IBS symptoms much more than other people. So the next question, we'll take it from Mr. Santoshi, Mrs. Santoshi, right? Hi doctor, I got relief from taking good bacterial pills for my IBS. How long can I take it? If I stop taking them, I suffer again. It is a very valid question and often encountered situation. So this good bacteria pills, or the probiotics which we call, are available over the counter in the pharmacy shops, and a lot of people take them on their own, and some people take prebiotics like curd or all this thing which has good bacteria. So all these things can be taken on a regular basis. There is no harm in taking curd, or we can take food which are fermented and they have natural probiotics into it. So if you don't want to take pills on an everyday basis, try to increase your good bacteria in your diet through the diet. So there is another question from Riaz. Hello doctor, at what stage is an endoscopy typically required? So little bit premise about endoscopy I would like to give it to you. Endoscopy, there are various kinds of endoscopies that have been done. The endoscopy which is done from above is called as upper GI endoscopy, and the endoscopy which is done from the rectum, it is called as colonoscopy. So this are indicated for various reasons. Like in my practice, I encounter people who are having problems like blood vomiting and all. So they have blood vomiting because of gastric ulcer, or they got liver failure, and from there they get liver bleeding in the vomiting, and this definitely warrants an endoscopy. So the requirement for endoscopy is guided by your symptoms, your disease, and your severity of disease and the symptoms. So let's take another question from Miss Charu 10. Can bloating, constipation be hereditary also? If yes, then how to deal in such situation? Yes, that's a very relevant question that you asked, Charu. Bloating and constipation, I would say instead of hereditary, it is generally familial, because it's seen in the many members in the family, and that's because we share similar kind of traits, whether the health related traits or a digestion related traits or a food habits or the environment. All these things we share. That is why it can sometimes run in the family. Like we have seen people where the parents have constipation and even the children do have constipation. So it's because of the shared genetics, environment and the diet. However, it's not mandatory that if a family member has a constipation that you must also get it. And however, even if you get it, you can get rid of it by following a good diet which is rich in fibers, taking high fiber diet, doing exercises at least 5 days in a week for 30 minutes every single day, taking a lot of water, and if in spite of this, if you're getting constipation, then please seek a doctor's help. So there is a question from Pensy, and it's been asked, what are the early symptoms of liver damage? So liver is a very mysterious and amazing organ in the body. Like it has amazing regenerative potential. So even till the late stages, generally liver don't show any kind of symptoms. Only on a blood test or regular health checkup, in your few blood reports, something will come abnormal. The most common blood report that is being done is liver function test, and the liver function test can show some abnormalities like elevated bilirubin or high SGOT, SGPT levels. And some people, they do ultrasound scan and they found some fatty liver or some problem in the liver. So these are the most common things that you find in the early stages. However, when the liver damage is more, patients do start getting symptoms like swelling on the legs, getting abdominal bloating because of accumulation of water in the stomach, getting blood vomiting or passing blood in the stool, or developing altered sensorium or mentation, or reaching to a coma stage, or getting jaundice, losing appetite, losing weight, getting itchiness in the body. These are all symptoms of liver damage. So next question is from Always Agasti, and he or she is asking, hi doctor, will intermittent fasting lead to any gastric issues? So nowadays this intermittent fasting is a very trending thing, and a lot of people are following this thing for a weight loss thing, and it's been found that it's really helping people in losing their weight. However, I am seeing many people in my practice who comes up to a doctor complaining because of intermittent fasting, they are getting constipation, they're getting bloating related issues. So yes, in some people, in a subset of people, intermittent fasting is creating some problem. So there is another question from Mr. Riaz, and he's asking, is there any test to understand the gut health status? So if you ask me, this is a very difficult question that you asked me, Riaz. So there is no one test to tell you if your gut status is good or not. In fact, if you're having symptoms, we can do a battery of tests to find out the various aspects of the gut. To tell you, a gut is a very complex organ which starts from eating food until excretion. So it starts from your mouth, food pipe, stomach, small intestine, large intestine, liver, gallbladder, pancreas, spleen, and so on and so forth. There are so many organs involved in the gut. The word gut is so small, but it has tremendous functions and complexity. That's the reason there is no one good test to find out the status of your good gut. The gut health is good or not. So the next question is from Kavyashri Tatikonda, and she's asking, good evening sir, what could be the reason for bloating after eating food, even if it is not sour or non-bloating food? That's a very good question. So Kavyashri, if you're getting bloating after eating food, this means that you're having dyspepsia. This particular entity is called as postprandial distress syndrome. It means that whenever you eat food, you feel early satiety, or even with less amount of food, you feel you are done, you are full, you cannot eat more. And if you forcibly eat a little more food, then you will feel some kind of discomfort or bloated, or you will feel very restless. And this is called a dyspepsia. So if you're suffering from dyspepsia, you need an endoscopy to check if you're having any H. pylori infection on the stomach or not, if you're having any gastritis, if you're having any gastric ulcer or not. If all these things are not there, we need to check if your stomach has become lazy or not. If your stomach has become lazy, and that's the reason you're feeling full after having meals, then we can write you some tablets or medicines to make your stomach more active, and that will reduce your bloating. So next question is from Satish, and he's asking, hi doctor, will grade 1 fatty liver leads to which issues and precautions please? Satish, I have already mentioned this thing in my discussion today. Grade 1 fatty liver is quite common. Almost 1/3 of Indian population is affected by this problem. If you imagine Indian population is 140 crores, so one third of them would be almost 45 crores. So almost 45 crores of people in India would be having grade 1 fatty liver. However, not everyone will have a serious effect of this thing. One tenth of these people will get some inflammation in the liver, and 1/10 of them will get some liver damage or liver fibrosis, which can end up becoming liver cirrhosis and can lead to liver failure. And now if you're asking me precautions, the most important precautions are that follow a healthy lifestyle, go for exercise every single day, lose the excess weight, avoid excessive alcohol, don't take over-the-counter medicines, take only prescribed medicines, get vaccinated, and seek a doctor if there are any abnormal reports. Thank you, Nazrul Shahid, for your kind comment over there. Yes, Nazrul, good to see you over here, right? I know you. And then the next question is, read that, okay. So, Mr. Nazrul Shahid is saying, Dr. Dhiraj is a very intelligent and experienced doctor. I advise anyone having gastric issues of liver related disease should visit Continental Hospital and ask his opinion. Thank you, Nazrul, for this kind comment. Kaveshri, okay sir, thank you. Then Satish, thanks a lot, doctor. So I believe this is a time for us to close our session. Thank you for tuning in today. Remember, it's never too late to address digestive health issue, let's take the first step together. For consultation, please visit Continental Hospital or call us at the given number. Keep watching this space where we will be coming more often live and address your questions. Thank you so much.